tell them like we can try it, but chances are like you're going to end up on dialysis or you're going to end up requiring a transplant. And a lot of times it's more beneficial for the patients to have a conversation telling them like, I think we need to just start preparations for transplant. And you guys know what is the recommendation for the National Kidney Foundation? When do you start preparing patients for transplant? So if the filtration is less than 20, and if you have a living donor, that's when you refer to the transplant centers. In the state of California, if you don't have a living donor, the wait time can be anywhere from 8 to 10 years. That's a long time. And like I told you guys, 80% of diabetics will be dead by year 10. Imagine if you have to be on dialysis for 10 years. It's a long time. So you educate the patients, you educate the family. I have a dedicated class for the patients, and they come with family members, and you outline the risk and benefits of renal transplant. The benefits are very clear. Increased survival, increased quality of life, and in every indicator, transplant is superior to dialysis or to no dialysis. But there are also risks associated with transplant. You guys know what are the most common risks associated with transplant?
Organ rejection.
Organ rejection. What else?
Graft versus host.
I'm sorry?
Graft versus host.
You can see that. Yeah, that's one of the things that you consent the patients for. What else? Remember, it's a very fine line between infection and rejection, right?
Yeah.
You're trying to keep the patients between that very narrow line. So infection and rejection are the more common, and malignancies. You guys remember what kind of cancer transplant patients develop? Okay, so the most common cancer is skin cancer. And the most common cancer among transplant patients is the squamous cell carcinoma. So that's why when you see a patient that has a transplant, you advise them to stay away from the sun. You advise them to always wear long sleeves, to wear hats, and to wear sunblocks every single day of their lives. Squamous cell carcinoma is pretty prevalent in this population, and every transplant patient should be seeing a dermatologist once a year for an annual skin exam. You can also see a type of skin cancer called KS, Kaposi sarcoma, and that's I don't know if you've ever seen that. It's like these violaceous lesions, like nodules, and it was first identified in the 1980s when we had like HIV was novel to medicine, and a lot of patients were coming with this type of lesions. So Kaposi sarcoma is also seen in transplant patients as well. When you look at the incidence of other malignancies in transplant recipients, it's actually pretty much the same for breast and colorectal cancer when compared to the general population, but the skin cancer is a lot more prevalent. And so cancer is a side effect that you need to consent. And the patients, they also have increased risk of cardiovascular disease, transplant patients, but the risk is much less than when they stay on dialysis or when they say no to dialysis. When they say no to dialysis, it's unforeseeable because they ask you a question like, how long do I have? Like, how do I know? Nobody knows. Because if you still urinate, you can keep going. You're going to be living very suboptimally. You're going to have like a lot of issues with your nutrition, with your volume status, with your blood pressure, with like uremic toxin buildup and the symptoms that I described to you guys earlier. But nobody can predict how long will it take for a kidney failure patient to expire. Nobody. Unless you become anuric. If you become anuric, it's a matter of days. Obviously, there's so much you can live without getting rid of your fluids, right? But just so you guys understand GFR, like let's do this exercise. You have a calculator there?
I don't like that.
Okay, just put a calculator there.
Yeah.
So let's say a patient comes to you with a GFR of 3. That's pretty low, right? So the National Kidney Foundation definition of stage 5 is when the GFR is less than 15, right? So this patient he's overdue for dialysis, right? So we're going to multiply 3 by 1480 minutes we have in a 24-hour period, right? 3 by 1480. How much is that?
4,400.
Okay, so that person that's the volume that the kidney is filtering in a 24-hour period. So you need to reabsorb only about 2 liters to still make urine. So you're filtering 5 liters and then you're reabsorbing 3 and then you're making 2 liters of urine. That's the reason why patients with advanced kidney failure, they still urinate. They still urinate. They stop urinating when the GFR is literally 0, literally 1 or 0. So that's the reason why you can't predict when somebody with uremia is gonna expire. They may get in trouble with electrolytes. They may get in trouble with volume because, like I explained to you guys on Thursday, having kidney disease is having a clogged sink. If you put a lot of water, it's going to overflow. But generally speaking, I've had uremic patients say no to dialysis, and it takes months. Sometimes, like I had a patient recently, he expired after 15 months. But what research shows is that if the patients, they're agreeable to do dialysis, they're going to have increased life expectancy. But for your boards, if you're asked what is the best option for a patient going in, suffering from kidney failure, the correct answer is preemptive transplantation across the board. You can't go wrong. If you answer preemptive transplant, you're always going to get it right. And the preemptive transplant happens when the GFR is less than 20. That's when you refer to a transplant center. If someone doesn't have a living donor, they need to participate in the UNOS list in the state of California. It's a long time. I had a patient that recently moved to, she didn't move. She actually had the money to pay for a transplant. She went to University of Iowa. The wait time, is that where you're from?
Yeah.
The wait.
2 weeks.
No, it was crazy. I've never heard of anything like that. The wait time for a renal transplant at University of Iowa was 6 to 9 months. It's insane. Here is 8 to 10 years. So,
Dying off, doing all their kidneys.
yeah, no. In the U.S., it's very difficult to get an organ. If it's not like UCLA. I think they got in trouble because they found they were doing some investigation because some Japanese donor ended up getting a liver and he bypassed the list and they were risking actually losing the license because you can't you participate with the same rules. All the centers here in LA and in California, they have to abide to the same rules. And the organ allocation happens with very specific criteria. And in dialysis patient, the listing can occur preemptively. In other words, a lot of my patients that have a GFR of less than 20, they're already on the transplant list. But the minute that you start dialysis, if you were enlisted before, that's when they start giving you, that's when you start accruing time for a transplant, the minute that you start dialysis. I've had patients telling me I don't want a transplant, and after 5 years they're so fed up with dialysis that they want to pursue the transplant route. And the good news for those patients is that they never lose time. They will be credited for the 5 years that they've been on dialysis. But the rules are pretty tough for patients. Let me give you another example. If you have a patient with hepatorenal syndrome, or you have a patient with fulminant liver failure requiring a combined liver kidney, those patients, they have different allocation rules. And there's a lot of, obviously, resentment from the kidney, the kidney, the waiting list for kidneys, because those guys, they need to wait in line, whereas the liver comes in and they bypass everybody and they get a liver and a kidney from the same donor because they have to do it that way. They don't necessarily have to do it. They can just give a liver, but because of compatibility and genetic, they have to give both organs at the same time. And then those patients are taking away one kidney for the people that are waiting just for a kidney. So let me give you another example. If you have hepatitis C, the wait time could be only 2 years or 3 years. Why? Because Hep C donors are more likely to die than non-Hep C donors. They have riskier lifestyles and behaviors, and there is less people participating in the Hep C wait list. So, those patients, they get it pretty quickly. Yeah. So there are a lot of different things. If you're a minor, if you're younger than 18, those guys take precedence over adults. But the sad part is that if you became dialysis dependent when you're 16 and then you turn 18 on dialysis, That's it. You go by the adult rules. I have a woman right now, she's 22, she's been on dialysis for 6 years, she couldn't get it. Because back then she wasn't listening. And the pediatrician kept telling her, you need to listen to us, you need to do this, you need to do that. She was never compliant, and they disqualified her from getting a transplant. Then she started becoming compliant when she turned 18, but the horses already left the barn. She needs to be on the adult wait list. So these are basically different scenarios, but for your boards, always preemptive transplant is superior. You can always get listed even if you're not on dialysis. And transplant is superior in every sense to dialysis. You know, mortality-wise and complication, lifestyle, quality of life. Yeah. All right. Any other questions you guys have?
No, thank you.
Yeah.
I just wanted to do a quick interview practice session since we have been.
No, he's the master. No, it's not me.
But we'll just, just so that those three bring a little bit. Miguel.
High five, buddy. So what are the three things that you think about before you say something?
Is it necessary? Is it kind? Is it truthful?
Very good. So let me just say it, pause. Is it truthful? Is it necessary? And is it kind? Okay? Those are the three things before you say something. That's good. So let me ask you, what year are you, by the way?
I'm actually a second year PA student.
PA student. Nice to meet you. Yeah. You just started your rotation here?
Yes, first rotation.
Very good.
Yeah.
Yeah. So you're gonna have a lot of learning here. We do a lot of teaching here. That's great. All right. So let me see a typical question. So
You know what? I'll ask the questions. Give them 2 seconds to answer, and then see how you answer them.
okay.
So, what was the worst experience in medical school?
Living with my mom and passing all my classes. Probably. That's right.
What was the worst experience?
Remember you talked to
For me,
people that have yellow eyes?
Yeah.
I seen someone who had completely
cousin
yellow
had
eyes.
a
Thank you.
problem,
You
a
tell me
medical
later.
problem, and she's the cousin I live with, so I had to take care of her while also going to med school and handle it pretty well.
Okay. What was the worst experience in medical school?
It's a tough question, man. You see the kind of stuff you're gonna be asked, and you're gonna be like, whoa.
And
You say,
the point of this is that, the reason I'm asking this question is that you don't just answer that question.
you think about it.
Number one, think about your response, and number two, you have time now to think about your response and to speak about other things that you want to bring across. So you don't have to just say no.
You want to make a case for every answer that you give, not just necessarily like the small picture, but you want to make your answers as a big picture. You want to go to that? Yeah. Almost. The worst scenario, you can probably say like not having the ability to rotate through whatever. Let's say if you want to do cardiology, like my work experience was not having the ability to rotate through the CCU, since I've been eager to be able to be exposed to such an experience. Yeah, like in other words, if you're aspiring for something, you don't. It doesn't necessarily have to be whatever you felt or you perceive as your worst experience. It will always require that you do extra thinking to make a case out of that answer to the person that is interviewing you. In other words, I'm not telling you to lie, but I'm telling you to be creative about the answer that you want to give to that person that's interviewing you. Because those guys that are trained to be able to hear these answers, they know they only have like 30 minutes to interact with you, and they are very well trained to learn patterns. Like if you're a negative person, they can sense that with the way you answer that question. If you're a complainer, they can sense that the way your body expression, your facial expression is. And then, like it's an art. I think like when you're confronted with these guys, you only have a few minutes. Like I told you guys on Thursday, you're gonna be sitting with a guy who has the same scores, probably better medical school, but you're gonna own that job because you're gonna have better answers. You need to make a case. Like I told you, like your paper needs to be congruent, needs to be consistent with what you're aspiring. If you have a paper like an essay or a personal statement that is all over the place and you're applying to this program but you're also applying to some surgical internship, I'm not going to take you seriously. I'm going to say like, no, this guy doesn't even know where he is. So that's why it's impossible for me to answer like specifically that question, but I want you to think about like when you read those examples of questions, you need to rehearse that. You cannot just go there and get destroyed. And that's what he did for me.
When I was interviewed, you could have answered that question.
Yeah.
Now it's years later. No, because I can't either.
Yeah, no, you have to. You know, like I was like completely paralyzed because I told you, like I was never exposed to a job interview. Like you go in because of your scores and that's it. And to me, everything was so new and so hard to grasp. And English is not my first language, so it was quite challenging. But what I'm very appreciative with Dr. Ben-Zur is that he made me realize that I needed to do this before I went in. For me, like it was the hardest of the challenges to become a physician here was to prepare for that day. You guys think it's an easy, simple, straightforward, but it has implications for the rest of your life. You know, like.
But I knew when they gave him the interview that he was done. Even though the guy that I spoke with said, "We're giving you the interview just as courtesy to you, but just understand that you will never
get into this program." And they gave it to me.
Why do you want to come to this program?
Because it has great exposure to underserved populations. It serves a lot of Hispanic-speaking or Spanish-speaking patients, and that's what I want to work with. And it has a wide variety of pathology. And when I get out, I want to be able to manage patients broadly and be their sole provider in an underserved location.
How would you answer that?
Well, first of all, like get to know the hallmarks of the program. So every program has a list of the things that they're proud of or they take pride. So just make sure that you, like Dr. Benz has always told me, like you don't have to tell them that you're great. You let other people tell them that you're great by writing your letter of recommendation and everything. And what you're going to be saying there is that you're going to be complimenting the great features of the program. Like you guys have let's say in my program, you guys have the only Chagas clinic in the country. I was fascinated when I learned about it. You know, I think this is an incredible opportunity for a U.S. student to be able to join a program where you guys are actually doing your own research about this entity that is absolutely unknown in the United States. So this is just like a simple example. So you're not going to say, because I'm do this, or I want this, I want that. You just tell them something very unique that resonates. They need to hear about, they're going to remember something unique about you, because you see a lot of people. Those days of interview, I was exhausted. I interviewed so many of them, and some of them, they will resonate in my brain. When we were doing the meeting, we were doing like every week, and we were like looking at the files with the pictures, and trust me, the people that said something that resonated, those are the people that we actually put in a different pile, believe it or not. But something like that, something that makes you unique, or about, like let's say I told one of the attendings, I didn't know that he loved horses. My wife has horses. And I told him, like, why do you want to be in this area? Like, well, because we have horses and this is a horse county hospital and eventually we want to buy property in this area. The guy loved that answer. And I didn't even expect it, that he was going to be a horse person. You know what I mean? Like, to go to that hospital that used to be, you have to actually stop so you can let the horses pass. So things like that. So you tell them things that resonate. You learn about the program. You just don't go there like, oh, it's another interview, I'm just going to go in there. If you don't learn about the program, you didn't do your homework. And I know it's exhausting. I know you guys have so many things in your heads. You're going to be traveling. You're going to be under financial pressure, spending money that you don't have, but just do the extra work. And my advice to you is, this is like do your interviews from the beginning to the end, to the less desirable to the more desirable program for you, because that way you coach. Like the one I really wanted was my last one, so I was like already like an expert, and it really helped me, because had I had that as the first interview, I probably would have not get it. So it's about practice. He had this guy actually record me, this guy right here, record me to analyze my body language, my posture, my responses. And then he also told me to look myself in the mirror and to do it every day. And I did it. And to buy a voice recorder and record myself. And then you realize, like, wow, that doesn't sound right. That doesn't sound like a good answer.
Now it's easy with iPhones.
Yeah, it's easy with the iPhone. You just do this, instantly. But remember, like, another tip, when you're interviewing, you never say good things about you. You let other people say those things. You want to actually compliment the other people. Like, I had an incredible experience at the Cardiovascular Institute. I met Dr. Ben-Zur. Why? Because when I listen to those words, I know that you are actually appreciative of the experiences that you learn here. And that actually sounds very good. Like when I hear like you're elevating him, like, and not elevating yourself, I realize, like, wow, this person is humble, she's eager, she's motivated. This is the kind of people that I want to work with. Instead of like having like a guy like, no, because I did this, I did that. They don't need to know any of your academic accomplishment. None of them.
Just an interesting story.
Yeah.
A couple of years ago, we had a student here. He was by far, I think I told you the story, by far the smartest person I've ever worked with. He was just on any level. And I'd give him just physics, echo thing. He'd understand it after a half hour. I was amazed. I was really, really amazed. And then, I can't believe I figured. And I predicted he'd already applied and he was waiting for a response while he was rotating here. And I told my sister, Leo, he's not going to get a job. And he told me, like, oh, my dad's a surgeon, and, he knows the program director, they grew up together, and blah, blah, and I rotated there, and they told me I'd get the job, and he just went on and on. I said, he's just not going to get along with people. And sure enough, we did the match, and he ended up, waiting a year and other things. So, getting along with, it's not just the interview process that you're doing and preparing for, it's also how you're supposed to behave, and how you get along with people. Like he told you, he was offered chief residency, Dr. Lopez, and every award that they've given him, and that's because of his, demeanor and his behavior, and you guys are like that also. It's just that you have to kind of sharpen your tools a little, just so that people realize that about you.
Yeah, so when you get there, whatever you did academically speaking, is already there in the paper. You just need to go there and then show them who you are as a person. And whether or not your message resonates, whether or not you look like a positive person or a negative person, or like a genuine person. And those are like 15 minutes that you need to fake it until you make it, in other words. And it's hard because these guys that are in this business, they know what they're doing. They know the kind of answer they want to have. So they're looking for hardworking, pleasant team player, and those are the kind of things, like I'm saying, like speaking highly about the experiences that you had, like positive experiences that you had, like wanting to do more or learning more about the program, the specifics of each program. You tell them, like there's nothing, like these people that are in academics, they're there for a reason. They're there for the love of academics, the love of science, the love of research. There's nothing that will make them happier if you know something about them. And it sounds silly, but if you know something about them, like you can even paraphrase them and ask them a question back, and they would love that, because they know already that you were actually really interested in the program, and you did your homework before you went in an interview.
Hey, Joseph. Good move there. How are you going to elevate this program?
I'm going to elevate this program. I'm going to elevate the program. I was hiding behind your head. I'm going to elevate this program with my positivity. Every day I come to the Cardiovascular Institute at
how we need to organize stuff. By the way, she comes in at 5:30 how would you respond to that?
I would say promoting the teaching and making it like the best rotation for all the medical students in my class. I think I'm definitely gonna get back and report out to my group the experiences that I had in this rotation, and the kind of people that I met, and how it was the most productive place. I think if we all have a mission, which is like making it educational and teaching, because that's what you guys are here for. You're here to learn. You're here to teach us as well, and we can teach you. But I would say like I can elevate this place by promoting the rotation. That's what I would say. Mm-hmm.
Yeah, I mean that's really important for us. We've gone through months without students in the place. Dr. Lopez doesn't come, and other lecturers, Dr. Tamari, who's usually 3 times a week, doesn't come. And so, but that wasn't my question. My question was, as a resident, now I'm speaking as a program director, how would you elevate this program? So.
Oh, how would you elevate the program?
Yeah.
Well,
I think that's a good question. By the way.
that's a great question. I think definitely. I don't know if you guys have worked on any PI projects throughout med school or through your college, but I would just bring some of the things that you've done before, and how would you how would you have a genuine interest in perhaps identifying where the issues, if any, from clinic, and try to work on a PI project that I can present with other co-residents. That would be a good way of answering. Because program directors, they love motivated people that actually bring ideas and like either scheduling or like workflow or like clinic related issues. So that's something I would say to the program director. Like I have, throughout my years of education, I've done like several PI projects. You can mention some of them and then tell them like we'll definitely be interested in identifying if there are any issues, if any, and bring it up.
Okay, I'm going to let you guys go because I know he wants to go, but I want to continue this with you guys.
All right.
Thank you very much for coming.
Thank you.
Do you say thank you?
Meet you.
Say thank you to everyone.
Bye. Thanks for sharing.